Marhaba and welcome to today's episode of The Doc is In. I'm Dr. Saima Khan and I'm delighted to be your host today for this podcast, which has been brought to you by the Cancer Institute at Fatma bin Mubarak Center, Cleveland Clinic, Abu Dhabi. Joining me today are our very distinguished breast oncologist, Dr. Bassel Jallad, and our very passionate, inspiring physical therapist who specializes in oncology, Elif Dalkilinc. Sadly, all of us have been impacted by cancer one way or the other, whether it's having the disease ourselves or through the journey of a loved one. Given the month of October, which is a breast cancer awareness month, we would like to talk about the significance of screening today and also the role of research. Just as vital, I would like to shine light on the fantastic rehabilitation service, which is a part of oncology longevity medicine program at Cleveland Clinic Abu Dhabi, especially the phenomenal role our rehabilitation team plays in making a meaningful impact on the quality of life of our patients. So Dr. Bassel, welcome. Dr. Elif, welcome. So Dr. Bassel, your work spans patient care, research, and advocacy. On a personal note, you have been my go-to friend since I joined Cleveland and my helpline anytime I have needed advice for any of my patients. What fuels that passion for you?
The passion for oncology, you mean?
Absolutely.
I mean, of course, thank you for this question. Truly, it's been a long journey since I finished medical school, and I have chosen oncology as my, internal medicine oncology as my, path for or career path.
Sure.
I like to help, patient as a doctor, but I felt oncology and cancer management is something that even 15, 20 years ago has been a struggle. We need more help, we need more support by doctors, by different services, by research in order to, create this good plan, long-term plan to try to eradicate or prevent cancer creation or in different type of the cancers. Breast cancer in specific has been something that I have been in a great interest in to try to help patients because it's growing in numbers. It's becoming more younger patients, and indeed we can do something about it. We can do something about it with screening, with different management technologies, and I felt also no place better than Cleveland to continue this mission that I have in mind, and to do more research and able to help our community.
Thank you. So breast cancer is the most common cancer, amongst women worldwide. And despite all the research, all the advancements, and all the new treatment modalities, why do we still consider screening as, I would say, the most powerful tool in this fight against breast cancer?
Such a great question, and it's a very important point to focus on, because if we are good and we want to really make a difference in eradicating cancer, we need to go one step back and try to prevent it. We do talk about from the level of primary care and internal medicine and preventive medicine is to try to minimize the bad habits, try to understand patient history, to try to change some of that as possible. But nevertheless, no matter how much we can do, there's still things we don't understand, and patients still able to create tumors or cancer that we were not or we could have not been aware of. So screening comes into this play, and screening will help to either detect changes in the breast. For example, I'm talking about the breast screening here because there's all kinds of screening for different type of cancers. But in the breast screening, people misunderstand that the idea is to find a problem to deal with in the middle of your busy life. But no, it's trying to get rid of a problem that can happen in the near future. You may find a tumor that have not caused invasion yet that you can remove before it reaches this point, or you may even find changes that you can monitor before it can transform to a tumor or a cancer. And this is the most important reason for the screening. Yes, if we found cancer, we could find it in an early stages. In fact, that countries that adopt screening better, they though may have look like more number of cancer, but they have earlier stages where it's better cure, and so a patient able to go back to their track and live normal life again.
It's actually really encouraging to see that number of breast cancer screenings actually, on the rise even in the region.
Yes.
And I'm hoping that the women who are listening after, hearing what you're saying, will actually not put this important screening off. You mentioned research a couple of times, and I just wanted to touch a little bit on that. Because I believe that you're deeply involved in research and clinical trials, and you are also member of the breast cancer committee at NRG Oncology. And for our listeners, NRG Oncology are global leaders in cancer research for over 30 years, I believe.
That's right.
How do you feel that, from your perspective, how does that shape the future of breast cancer care?
That is excellent question, and I'll tell you what we're trying to do here at Cleveland. I joined about 5 years ago. Yes, we wanted to make sure that this service is first established, and we're able to take care of our patients based on the available standard of care, available technologies across the world, medications, that they need to create that team and that can in different ways help to heal or take care of the cancer once and for all, from surgeons, from plastic surgeons, radiologists, pathologists, and medical oncologists. Once we have established that about few years back, we felt the next thing we need to ensure that we have a good plan for the future, and that's where research come into play. And so we are now having this as one of our priorities to grow in research. We have already collaborated with different companies to bring the global research that used to only be exclusive in Western countries like Europe and USA, now is in the GCC. In fact, we have some research started the first time in Cleveland Clinic, Abu Dhabi. One of those projects or trials is called Cambria 2. We were the first to, and I am the principal investigator for that. And the point here is to bring treatments that out of the box, next generation treatment to be tested or to be, we know that it may work, but it's a matter of time that all the different organizations to prove this drug and to accept it to be used for everybody needs to be studied in a very strict way. And so you bring potentially excellent treatments and technologies earlier for under our disposal for our patients, in order to them get to try it and to get the use of it many years before it's accepted. So that's the point here, and to collaborate with NRG, for example, a big known organization for research across many decades. We are the first to be part of this initiative in outside USA. Very few countries only have that, including like Australia and Japan, and yes, we have it in UAE. And I am one of the fewest international members with them. And the idea here is to be part of even creating those trials, to bring ideas that is matters for our population, younger population, different ethnicities, and in order to make them part of the what we should be experience or the trials that we should be in. So this way we are representing our community, and all of this brings extra level of care for our patient and to try to be part of shaping the future.
Thank you. This sounds an amazing opportunities for our patients in the region. But clinical trials, do you feel the patients feel intimidated? How do you explain that importance? Do you find it's difficult for patients to get engaged when you discuss this with them?
It's a new culture, it's a new concept for them.
Sure.
We have been more and more increasing awareness about the importance of clinical trials and research. And yes, there's more adaptation now, adoption to the point that we already have been enrolling patients here from different ethnicities, Emiratis or non-Emiratis, accepting the point that they want to be part of shaping the futures. So, but in a very controlled and in a very well studied trials. We are already filtering the trials that we believe they could be eligible for, and we have a very thorough, very strict criteria to ensure this drug or this trial would be best suited for different for that patient. So it's an individualized care, as it is for the standard of care. It is
Sure.
individualized care, and the clinical trial enrollment and monitoring is also individualized, and we have all the measures. It's been now a few years, but we have taken all the measures to make sure this is something that will come after all to the benefit of our patient and our community.
Excellent. So, Dr. Bassel, you are the chair of the International Breast Cancer Symposium, 4th year in a row.
That's true.
So, how do you feel that stage helps in terms of knowledge sharing and collaboration, both nationally and internationally?
Well, that's another pillar of our mission here in UAE, other than, again, taking care of our patients, bringing clinical trials, and increasing the awareness and educating our current doctors, next, our future doctors from students, fellows, in training, and also the community. I mean, everybody is welcome to be joining us in our annual or symposium that usually we do it in October because it's part of our awareness campaign.
Sure.
And this year is on October 10 and 11. Everybody is welcome to come and listen to the understanding how to treat breast cancer. So it's refreshing our memories about what is there, also talking about future developments, and be part of a dialogue between different the specialties, how they all interact with each other for the better good of the or optimizing the care of our patients. So this is indeed Cleveland mission. We've been very successful over the years. This is our 4th edition to do that, and every year there's more people coming, not from just UAE. People are interested to come from the region, Kuwait, Bahrain, Saudi doctors who approached me last year saying how feel grateful about this, and this makes me proud that we are being visible and recognized globally, and regionally and globally, because we have also international speakers who join us just for the sake of education and to be part of the awareness, improving awareness about breast cancer and what's there for our patients, and that's really the idea.
Thank you, Dr. Bassel. So, Elif, welcome. I have seen firsthand how truly fantastic your rehab center is. I mean, all the innovative tools, and especially your biofeedback technology, and the expertise you and your team bring to the table. We of course share quite a few patients, and I've heard really positive feedback about the one-to-one sessions. Your patients really value them. So how does this one-to-one session fit in with your group sessions?
Thank you so much for your kind words, first of all. So when we consider cancer rehabilitation, it's not only just restoring the movement, especially after the breast cancer surgeries. It's also about giving the cancer survivors the strength, the confidence, the independence to reclaim their life back beyond the treatment, really. So that's why we always begin with detailed assessment of our patient, and after the assessment we set the goal, meaningful objectives to achieve together. And then we start treatment planning together with our patients. What is the goal? What is the impairment after the detailed assessment? And then we decide if the patient get benefit more from one-to-one session or individualized session or the group setting sessions. And we offer one-to-one session as well as the group session in Cleveland Clinic, Abu Dhabi.
So I believe you are bringing in yoga and sound healing to your sessions. Now, as a lifestyle physician, it really warms my heart because you're addressing the stress, the sleep,
Exactly.
the exercise, and also really positive social connections as well. So how do you feel this integrates with your physical therapy sessions?
Yeah, so we are providing yoga sessions both inpatient and outpatient. So I think inpatient yoga sessions are maybe one in the region, and it's really helping our patient to feel confident even though so much going on. They just did the surgery or they are admitted for some other reasons. But we can show them they can still do so much. It's a chair-based yoga session, and we are combining with sound healing as well. And sound healing really adding another layer of the benefits, that they feel good, their mood change, their stress level reduce, their pain perception also change, because sound healing and kind of meditation or mindfulness technique really help us to regulate the nerve system. So it's calm the nerve system down, and people start feeling much better, even so much going on due to the ongoing treatment.
I see patient loving it, really. I mean, I've heard a lot positive feedback about that.
Yeah.
And I see becoming us more and more professional, organized, and growing this service.
Yeah.
So combining physical and holistic services together, I think, is more than just 1+1. I really think is helping patient physically and emotionally at the same time really help better, not just focus on curing the disease, but healing that person.
Sure.
Is also goes hands side by side.
Exactly.
And something else, Dr. Bassel, I wanted to mention was because some of the breast cancer treatments, though they are life-saving, can put a strain on the heart. So what has your experience been in terms of the cardiac rehab? Because I'm aware that you are referring patients quite earlier on to the cardiac rehab team. So how do you feel that benefits your patients, and how do you help them as well?
Excellent question. I mean, we know that the idea also, as much as possible, to cure or heal a person is to do no harm, and we try our best with the treatment that we give. It may have some side effects, what we call, or some complication, potential, not all the time, but potential complication to the heart. And so getting our patients screened earlier and monitoring them appropriately, and if we felt they would need cardiac rehab, and especially after finishing the treatment on long-term survivors, we will implement it. We will implement it early when we feel some signs of changes that to their body and physically, and the heart also in the after even they complete their treatment as part of their recovery, and I think between combining our monitoring plan plus the recovery and the cardiac rehab will help to ensure, after all, that our plan goes as we wanted, optimized, and at the same time patient to be back on track and recover their body, because we understand generally they have this fatigue feeling or tiredness, and muscles, heart including, may get some partial affection from the treatment, and so it's important to ensure patients to stay fit and strong.
So Dr. Bassel just mentioned fatigue, which I'm sure is a very common concern patients come to you with, Elif. How do you support them?
Yeah, fatigue is one of the common side effects after the cancer treatment, during and after the cancer treatment, I would say. But yeah, we can offer so much to manage fatigue. So we have specialized physical therapists and occupational therapists to address fatigue. So our occupational therapists really educate our patient how to pace themselves, what kind of energy conservation technique they can use, if they need any kind of adjustment at home, at work, if they are struggling on neuropathies, for example, along with the fatigue, if we can support them in a way to improve this kind of side effects. But there are lots of studies really suggesting that exercise is the best medicine to manage fatigue. But all our patient knows, maybe heard from the social media or heard from the friends as well, that you need to exercise, but they don't know how to start. What kind of exercise would be suitable for them? And if we consider the cardiovascular endurance effect of the treatment as well, they need some guidance. Sometimes they need some close monitoring while they're exercising, how much the heart rate should be, what the exercise level should be. So they need some guidance and they need some gradual progression on their exercise. But yeah, doing exercise, some form of exercise is really, really beneficial to manage fatigue as well.
So you mentioned neuropathy. I believe you have some cool gadgets and things you do with the patients, which really help them with the neuropathy symptoms as well.
Yes, true. Unfortunately, there are some limited evidence to manage or reduce neuropathies, especially after the chemotherapy. But there are some good evidence on, again, exercising, some gentle stretches, nerve gliding exercises. Proprioception exercise or balance exercise also helps a lot. And we also use intermittent compression therapy, which sounds really promising to manage neuropathies. And our patients feels really good after the compression therapy as well.
So something else I would like to touch on is the scar management, because I feel that sometimes that is often overlooked in recovery. How does your expertise help women in terms of scar management?
Yeah, especially as a physical therapist, after any kind of surgery, we are always very careful about the scar management. Because first of all, the poor scar mobility can cause lots of adhesions in the area, may restrict the joint movement, may cause so much pain, limit the blood circulation, limit the lymphatic circulation. So it really put the patient in that vicious cycle. They don't even look, they don't even touch the area. So that's why in the sessions, we really wait until the wound completely heal and then check with the surgeon, of course, if it's okay to start the treatment. And then we start treating around the incision first. We improve the soft tissue mobility, and then we directly work on the incision itself as well. We want to make sure that all the soft tissue in the area are moving well in all direction, and there's no tightness, there's no pain with the palpation, with the touch. And then we want to make sure that our patient feeling okay to touch the area, and there's no restriction on their daily life routine.
Sure. Dr. Bassel, do you want to add something?
I mean, I think the job we did, the work we did into, getting the best really in the area for physical therapy, going beyond just the idea of helping with joint movements. We go beyond that. A very professional team really help with the doctors to reach the best outcomes in regarding to treatment and management. for me is I've seen it grow over the last few years, and I'm very impressed. I'm very proud of how the team is able to support the doctors. I mean, maybe we are in the front line, but really all this matters, and this what can bring the extra level of care that we are delivering here in Cleveland Clinic. And I'm proud also, let me say that in our symposium, breast symposium, we have a great team. It's not about just, talking doctors, giving topics. We try to go beyond this. And we have all the disciplinaries really giving presentations, including Elif, including Dr. Saima, giving their, opinion about how they can how they can be part of the breast cancer care, what they can deliver to the patients, and that is for me is another thing that I was proud of to start since last year. We had a nursing and a pharmacy track, and this year we have also holistic, and we have supportive care and longevity medicine part of this education.
So Elif, are there any other concerns patients present to you with, and how do you address them?
Sometimes we have our patient complaining about pelvic floor issues as well due to the side effects of the treatment. It can be urinary frequency, urinary urgency, urinary leakage, fecal leakage, and kind of pelvic pain which affect their life in a bad way. But I can say in Cleveland Clinic Abu Dhabi we have specialized physical therapists working only with the pelvic floor issues, and we can address this common complaints as well. We use biofeedback to retrain the pelvic floor muscle, which shows really great benefit to improve their symptoms. And also sometimes we see our patients struggling to go back to their normal life. They are struggling on doing the house chores, for example. They are too scared to do too much too soon. So that's why we are kind of emerging the innovative treatment called virtual reality in our rehabilitation. And it's really helping our patient to feel like normal and practicing that specific function with the virtual reality gadgets, which makes them more engaged to the session, change their pain perception as well. And in general, it really helps us on helping them to feeling normal and going back to their normal life again.
Thank you, Dr. Bassel. Thank you, Ali, for such an insightful and heartfelt conversation. For I'm sure our listeners will walk away not only with more knowledge, but also a sense of hope and reassurance that we provide a great service not only during the breast cancer treatment, but also afterwards. For our listeners tuned in, please remember, screening saves lives. Until next time, stay safe and take care. Thank you.